Should you follow a low FODMAP dietary restriction? Imagine feeling bloated, experiencing stomach pain, or having irregular bowel movements almost every day. If that sounds familiar, you might be wondering if a special diet could help. Today, we're talking about the low FODMAP diet and whether it might be right for you. A low FODMAP diet focuses on reducing certain types of carbohydrates called fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are sugars that are poorly absorbed in the small intestine and can cause digestive issues. When these sugars ferment in your gut, they produce gas, leading to bloating, pain, and changes in bowel habits. This diet is mainly used to manage symptoms of irritable bowel syndrome, which affects many people, especially millennials concerned about their gut health. The diet has two main phases. First is the elimination phase, where you avoid high FODMAP foods completely. This lasts about 4 to 6 weeks. During this time, you might need to cut out foods like certain fruits, vegetables, dairy, and sweeteners. After that comes the reintroduction phase. Here, you slowly add back foods one at a time to see which ones trigger your symptoms. This helps you find your personal tolerance levels and allows you to include as many foods as possible in your diet. But it's important to remember that this diet can be restrictive and tricky to follow without guidance. Cutting out many foods might lead to missing out on important nutrients. Working with a dietitian can help you plan meals that keep your nutrition balanced. They can also suggest supplements or probiotics to support your gut bacteria, which can be affected by the diet. For example, beneficial bacteria like bifidobacteria may decrease, but probiotics can help restore them. For many millennials, balancing gut health with overall well-being is key. The low FODMAP diet isn't meant to be a permanent lifestyle change. It's a short-term tool to identify food triggers and reduce symptoms. Following it requires commitment and professional support to do it safely and effectively. If you have persistent digestive symptoms that haven't improved with other changes, a low FODMAP diet might be worth considering. Just be sure to consult a healthcare professional before starting. They can guide you through the process, making sure you don't miss out on essential nutrients. For those without digestive issues, this diet isn't usually recommended because it can limit healthy foods and impact your gut microbiome. So, think of it as a targeted approach to help manage specific symptoms, not a one-size-fits-all diet for everyone.